to organizer to invite me. Respected chairpersons, dear audience, I'm basically surgeon. I have been working in only medical university in our country. I should have emphasized to surgical aspect, but in this conference, I want to show the basic scenario in our country. Hugely populated country in Bangladesh, 160 million population within the 55,000 square miles. And the 50% are female, and illiteracy about 45%. 31% below poverty level. And this is the scenario. And health infrastructure in our country, primary, only for primary health care, secondary, only emergency and routine surgery done, but tissue diagnosis, mammography, radiotherapy, chemotherapy facilities are not available. But in tertiary hospital, almost all facilities are available for diagnosis as well as treatment. Data of breast cancer in Bangladesh, usually in developing country, there are so many controversy for data. Approximately 22,000 women developed breast cancer every year. Many of them never seek treatment. About 70% die without treatment. But this is the data or statistics whole country. The topmost is lung cancer and second is breast cancer. And in our university, tertiary hospital, the breast cancer is the topmost. I want to show something. We faced so many patients of breast cancer. I want to show basic scenario, the clinical presentation. Bangladeshi female actually socially and religiously conservative, literally and economically below average. Lump, when first identified, already attain a big size. Patient do not know about self-breast examination, thought social harassment. No facility to do it in house or in pond. After identification of lump, applied hot compression, lime, herbal medicine called neem patai leaf that causes abscess formation. Sometimes lump in the breast, it is assumed to be a normal phenomena which will subsequently disappear. As a result, patients do not attend health worker or health center. Large group with nipple discharge along with lump to attend quack, so-called local doctor, not for the tumor but for social and personal discomfort. Applied neem pata causes abscess formation with the idea that discharge from abscess will reduce lump. As a result, disease become advanced. Few patients with axillary and supraclavicular lump, fungatic mass with bleeding, disease already become advanced. After nipple retraction, they try to protrude it by application of jelly for curative purpose, but with the time disease become progressed. The patient with Paget's disease get treated by local doctors as eczema, keeping the cancer ignored. Some patients with lump attend to field workers, treated with drugs, no improvement. They are psychologically upset, refusing any further treatment and ultimately found to have advanced cancer. Nipple discharge with crust formation as a result of application of some antiseptic and subsequently sloughing out of nipple and areola, resulting in an ulcer with loss of nipple and areola. Another group of patients who presented with recurrent lesion after excision of lump with no histopathological examination report no prior FNAC or mammography. They are mostly treated in primary and secondary hospital. A very small number of patients found to present with recurrence after partial mastectomy. They often have no axillary dissection and has ugly scar. In tribal population, 1% of our population, tradition of application of hot water on a breast lump, resulting in skin sloughing and unhealthy ugly wound. When they finally reach health center, they diagnosed as breast cancer. Some tribal population do not consider a lump to be as significant unless they are big. This is the clinical presentation data. Homeopath and herbal application about more than 62% patient, and other scenarios this. Lack of diagnostic facility. We also lack of facilities to diagnose malignancy at primary and secondary level. We do not have histopathology, FNAC, mammography at primary and secondary levels. Many patients cannot go to tertiary level hospital. The investigations like receptor study, bone scan are expensive and not available below tertiary level hospital. So many patients cannot afford the cost and go for much less expensive treatment, homeopath and herbal. About treatment purpose, we are treating huge number of breast cancer patients in our country. Our many limitations within our capacity. We are treating properly to some extent only tertiary level hospital, not primary and secondary level. Our patients do not come to us early as there is lack of awareness. We also lack of skilled surgeon at any level, and female surgeons are a rarity. Oncologists are also lacking, not sufficient even in tertiary level and specialized center. Many patients who get wrong treatment, we lack a cancer board which is essential to provide a consensus plan of treatment for each patient. Only cancer board running in tertiary hospital in capital city, Dhaka. Patients fail to understand the gravity and importance of the situation. They do not consider it to be a problem as there is no pain. Our culture and religion form a conservative society where the woman and the family are uncomfortable to see a male doctor for breast problem. Most of our surgeons are male. Many take homeopathic medicines and other indigenous medicines as they are cheap, widely available, and also financial constraints of the poor people inhibits to see a doctor. We have patients who have lumpectomy done by non-certified surgeon and no histological examination, and malignancy remain undiagnosed. Some patients are treated by certified surgeons with partial or incomplete mastectomy due to lack of training. Breast conservative surgery rarely practiced because of inadequate post-operative therapy, radiotherapy or chemotherapy, and improper post-operative follow-up. Sentinel lymph node biopsy is only possible in 2 to 3 centers, only capital city Dhaka. After surgery, many women do not continue chemotherapy because of fear of side effects and most importantly because of its high cost. Facilities for radiotherapy are also very less. Only 2 to 3 centers at private level hospital have proper machines and not many can avail this. Drugs are not also available everywhere, found only medical college based city area and capital city Dhaka, Bangladesh. Many patients fail to avail timely treatment or discontinue treatment as they are unable to reach to political turmoil, road blockage, strikes, and natural calamities, which are common problems in Bangladesh. This is the treatment data in our medical university. We have done so many surgery, but mastectomy with axillary dissection more than 80%. and breast conservative surgery, only less than 1%. Patient receives toilet mastectomy, more than 12%. Confused to visit, where to go? Quack herbal, female practitioner, gynecologist, oncologist, or surgeons. But lack of awareness about where to seek help or whom to report, social and religious binding, and a lack of facility. Unavoidable advice from various persons, shuttle between surgeon, oncologist, female doctors are available nearer to their home. Fear and rejection by their surroundings and families, fear about organ removal, side effects of therapy. Protocol, there is no national protocol and screening program in Bangladesh to perform standard unique treatment and to detect early breast cancer. Medical University has adopted a surgical treatment protocol of breast cancer, which has followed most of the hospital and health center in our country. Separate screening program, institutional based in our university, and wide-based national pilot project along with cervical cancer program. I worked as focal point breast cancer screening program. We tried to train field worker, nurses, and paramedics, and also doctors to overcome religious and social bindings. We started outdoor-based screening program as well as awareness program for breast cancer detection as breast clinic. As a result, the number of early cancer detection is easier. This is our handout, self-breast examination and clinical breast examination, and also we try to develop referral system, primary, secondary, and tertiary level hospital. But all are the negative point in our country, but this is the reality. Truth is truth. We faced many problems, but Bangladesh go ahead. We try to treat our cancer patient along with increased literacy, decreased poverty, overcoming religious bindings, removal of ignorance, go to proper place, health education, and knowledge about cancer. And try to advise more green leaf vegetable, give up smoking, and balanced diet and exercise. We also try to counseling and psychological support, train manpower, involvement of NGO and socio-cultural organization to overcome those bindings, and also try to rehabilitate the treated patient. Thank you very much.